and you pull someone off those things, they crash. And he really suffered. I mean, he felt horrible.
So what can you do?
So you can take other things. This is where we use medicines like Clomid or Clomiphene, HCG. There's botanical herbs. You're trying to just support the whole hormonal system. But there's going to be a fall off. I mean,
from your perspective then, and I guess you can't prescribe a specific age because everyone's different, but typically when's the moment when you would go to one of your patients and say, okay, now's the time to maybe intervene with this tool?
I think when they're symptomatic.
Okay.
So, and again, I see it presenting with, their nervous system, right? And so they'll get fatigued because I've been on testosterone for a good, 15, 20 years. And when it's low or I've been off, I can't stay awake during the day. I get cranky. It's harder to laugh. It's harder to feel good and positive. You don't sleep well. And so you start to see that from a man's perspective. Women are different. Women don't have those same types of feelings, but women, will measure their hormones. For a female, we think their total testosterone should be 40 or higher. That's where it should be. Most women are way less than that. And so they tend to be, again, we're trying to say the way you feel is related to the level of this hormone or that hormone. So for women, it can be similar: decrease in muscle mass, gaining weight, brain fog, just not feeling that, confident. The challenge with women, like Kelly said, is some women's skin is sensitive to testosterone. So if they take it, now they're going to break out, get oily skin, acne, facial hair, things like that.
Ooh,
and so you just have to find that balance.
Yeah,
it's a balance. So a lot of women can do well with testosterone just sparingly once or twice a week. Whereas men don't really tend to care about acne and oily skin.
What about the pellet that people put in?
I'm not a fan of pellets.
Okay, can you speak on that?
Yeah. So pellets would be a convenience way, right? So you're taking a pellet of hormones, usually testosterone, estrogen are used. They're administered under the skin. And the idea is they're long acting. So they're going to sit there for a while and slowly over time kind of deposit the hormone into the bloodstream. Problem is, I've seen a lot of problems. One, people have gotten abscesses from administering, getting the pellets inside their skin. You get very high levels. My main problem is you get super, super high levels of hormones. I like to mimic what's happening in nature as we do hormone replacement. And never in nature would you come across that much testosterone or that much estrogen at one time. You just wouldn't. But people like it. So a lot of guys will get pellets and they're like, I'm Superman. You are, but then there's usually a fallout and it's hard to maintain. And for men, a lot of them really like the trajectory of, I'm at a low testosterone, now I'm at a super high. And that steep curve is like, I can tackle the world. But then they plateau or they decline and they're like, well, it's not working. Well, it is. It's just you had, unrealistic goals. So I think there's a lot of reasons not to use pellets.
The mini penis clit was from a pellet.
So it could have been way too much.
That makes sense. And I think this brings me to my next question. The other day, I saw this thing about this doctor talking about semaglutide.
Mm-hmm.
Is that how you say it?
Semaglutide, yeah.
Semaglutide.
It's like one of the brand names, yeah?
Yeah, it's one of the brand names.
That's the generic. So Ozempic.
But she was saying she does not like the Ozempic pen because it's one size fits all.
Sure.
She prefers to use semaglutide as a microdose.
Sure.
I think I sent it to you to get your opinion for the podcast.
That's what we've been doing for a couple of years.
Okay, can you explain the differences between that?
Yeah, so the semaglutide or Ozempic, that's just where it started a couple of years ago. FDA approved for type 2 diabetics to help with blood sugar management. And what they found was that people were losing weight. And so then people caught on to that and doctors started prescribing it for not just diabetics, for anyone wanting to lose weight. And it's a brand name medicine, comes in a pen, a click pen, and it's actually a peptide, the Ozempic. So it's not the patent form. It's the pen is what's patented. That's why it's a brand name. And so and a lot of these drugs get put in pens so that they can be a brand name medicine. So what was found is very convenient. Once a week shot into the subcutaneous tissue, people reliably lose weight. With that one, the Ozempic, the semaglutide, there tends to be more nausea and then constipation. And then there's version 2.0, which is Mounjaro or tirzepatide, which we use a lot more of. Less nausea, less side effects, but faster weight loss. And the idea with getting a compounded form is just like you're saying, we can play around with the dosages. We don't have to be at a set dose. It makes it so much easier. So again, we're going back to what you guys started with, like, how do we feel like we're different? We want to walk the walk with patients. And so we want to be there for them, even if